Now guys, moving towards the next major nerve in the lower limb. Out of the 5 major nerves, we have completed common peroneal, deep peroneal and superficial peroneal nerve. Now moving towards the next one, that is your tibial nerve, and it is the most important one. Why? Because we are going to cover like many points here or many topics here. Try to recall from the golden rule. Tibial nerve is the one which is going to supply to all the posterior compartment of thigh, posterior compartment of leg, and not only that, the tibial nerve will enter into the foot, dividing into medial plantar and lateral plantar, supplying to all muscles of foot. That's the reason why I'm telling you in this topic, like many things we are going to complete. The posterior compartment of thigh, the leg, and then even the foot. It is the biggest one. Okay. So without any further delay, let's get started with the tibial nerve right now, sir. Now, whenever you learn about any nerve, what is the first thing to write down? First, write down about the origin of the nerve, guys. It's originating from where? And my students are actually experts, guys. In the very beginning, when we studied lumbosacral plexus, I told you tibial nerve is the one which will be originating from anterior division of L4 to S3. It's originating from the anterior division of L4 to S3. That is the origin of tibial nerve. And here itself, you also write down there, it is a part of sciatic nerve, so that you don't forget this during the revision. So what is your sciatic nerve made up of, sir? Nothing but tibial nerve plus common peroneal nerve. So sciatic nerve has got like two components, tibial nerve and common peroneal nerve, and now we are concentrating on tibial nerve. So tibial nerve is a part of your sciatic nerve only. Now after learning about the origin in detail, let us know about learn about the supply. Tibial nerve supplies to which all muscles? And now starts the real story now. It will be supplying to all the posterior compartments. So let us do one thing, let's deal each and every compartment one by one. First I'll teach you about the thigh, and then the leg, and then the foot, guys. So tibial nerve will be supplying to all the muscles present in the posterior compartment of thigh. All the muscles present in the posterior compartment of thigh. Now I hope that every medical student knows what are the muscles which are present in the posterior compartment of thigh. In the posterior compartment of thigh, we'll be actually having the hamstring muscles, sir. We'll be having the hamstrings. And what are these hamstring muscles? Number one, there will be semitendinosus muscle, and then we have got semimembranosus muscle, and then we have got the biceps, and of course here it will be biceps femoris muscle. So semitendinosus and then semimembranosus and then biceps femoris muscle, these three are your hamstring muscles present in the posterior compartment of thigh. Now let me show you a picture for this one in the atlas image, so that the things will become easier for you. Look at this beautiful picture here. The moment you look at this diagram, definitely it is the posterior compartment of thigh, and in the posterior compartment of thigh you are able to see all your hamstring muscles, sir. Hamstrings. And in this will be the muscle which is a semitendinosus muscle over here, and we can clearly see in the diagram there, the semitendinosus is like overlapping the semimembranosus muscle present over here, guys. So it is semitendinosus and overlapping the semimembranosus muscle. And please keep an eye on these two muscles. They are actually present on which side? They are on the medial side. Now why I'm actually asking you to remember this one? Why? Because semitendinosus and semimembranosus are present towards the medial side, and later on we are going to study about the topic of popliteal fossa, and it is going to form the medial boundary of the popliteal fossa, guys. So that is how I'm planning the things to make it easier for you people. So semitendinosus and semimembranosus, both of them are hamstring muscles, and that too towards the medial side. They will be actually forming one of the boundary of popliteal fossa. Now what is the third one? Biceps femoris muscle. And whenever you come across the word as biceps, there will be like two heads. One will be the long head, another one is short head. So therefore, you can clearly see in the diagram, this will be the long head of biceps. And if you are able to appreciate here, yes, there will be a small one present here, that is the short head of the biceps. And biceps femoris muscle will be towards the lateral side. It is forming that lateral, superolateral boundary of popliteal fossa. So try to, make the concept from here itself ready in your minds. Okay, we'll learn about that topic later on, by the way. Popliteal fossa, not now, that is not our topic right now, but still keep on making the planning ready for that one. So coming back to our topic here, we are learning about tibial nerve. tibial nerve supplying to posterior compartment of thigh, and in the posterior compartment of thigh you will be having hamstring muscle. In the hamstring muscle, semitendinosus, semimembranosus, and then bicep femoris. These three are done here. And now I'll tell you certain exceptions over here, guys. There'll be like two important, or we can say two important MCQs possible here. Welcome. Now in the posterior compartment of thigh, you'll be having bicep femoris, and bicep femoris means it will be having like two heads. One will be the long head of biceps, and another one will be the short head of biceps. Long head and the short head of biceps. But remember, even though it is present in the posterior compartment of thigh, both of them are not supplied by tibial nerve. Even though biceps femoris is present in the posterior compartment of thigh, like bicep femoris, both the heads, long head and short head, are not supplied by tibial nerve. Out of these two, only the long head is supplied by tibial nerve. Only the long head is supplied by which nerve, sir? Tibial nerve. Then what about the short head? Remember, short head is actually supplied by your common peroneal nerve, and that's an important MCQ here, sir. Short head of bicep femoris is supplied by common peroneal nerve. Fine. So it is one of the exception here that common peroneal is actually supplying to the short head of the bicep femoris. And apart from that, if you recall in our previous topic when we learned about common peroneal nerve, deep and superficial, I don't know whether you have appreciated or not. There we actually studied only about the supply of deep peroneal and superficial peroneal nerve only. I have not taught you any supply to any muscle by common peroneal nerve, and we are learning here for the very first time. Common peroneal nerve has got only and only one muscle supplied, and that is short head of bicep femoris. That makes it a very important MCQ, guys. Okay, so it is supplying to only one muscle, that is short head of bicep femoris. Important. Now one more thing here, tibial nerve in the posterior compartment of thigh, it is also supplying to one more muscle, and that muscle will be adductor magnus. The moment I write here as adductor magnus, I am sure you are bound to get confused here. So right from the beginning of the topic, I have been telling you adductor muscles are present in which compartment? Medial. And if they are present in the medial compartment, there has to be supplied by obturator nerve. Then how come suddenly you are including the adductor magnus muscle over here, sir? Yes, I will tell you the answer, don't get confused here. Now most of the students, what they'll be doing is they'll be concentrating only on one word, that is adductor. Adductor present in the medial compartment supplied by obturator. I request you to please shift your concentration onto magnus. The word itself is telling you it's a big muscle, huge muscle. Now try to understand like this. For example, if this is the thigh here, and all the muscles present in the thigh are divided into three compartments. One is anterior, another one is posterior, and then medial compartment of the thigh. In the medial compartment of the thigh, you have got a muscle that is adductor magnus muscle. And it is such a big muscle that it is also present in the medial compartment, as well as a part of that is extending behind into the posterior compartment. So it's a big muscle, it is present in the medial compartment, as well as a part of that is extending behind in the posterior compartment. That's the reason why doctors have divided this muscle into two parts. There will be in the medial compartment adductor part of adductor magnus muscle, and similarly in the posterior compartment you will be actually having hamstring part of adductor magnus. I repeat again, adductor part of adductor magnus and hamstring part of adductor magnus. And now my students are intelligent enough to, yes, decide the nerve supply here. Now what will be the nerve supplying to adductor part? Being in the medial compartment, it should be definitely supplied by obturator nerve. And what will be the nerve supplying to the hamstring part? Being in the posterior compartment, it has to be supplied by your tibial nerve. That is the reason why I wrote it here, guys. So therefore, in the posterior compartment of thigh, adductor magnus is supplied by tibial nerve, but not the entire muscle. Remember, only the hamstring part. So adductor magnus, only the hamstring part will be supplied by tibial nerve. Take care about that. So better we'll do one thing over here, guys. Better let us write down this entire story of adductor magnus muscle as a note here. So therefore, adductor magnus muscle will be having two parts. The part in the medial compartment will be adductor part, and the part which is extending behind to the posterior compartment will be hamstring part. Hamstring part. And out of these two parts, remember, adductor part is the one which will be supplied by obturator nerve, whereas hamstring part is the one which will be supplied by tibial nerve. I hope you are able to recall one important concept here. Yes, whenever any muscle whenever any muscle is supplied by two nerves, that muscle is actually said to be your composite muscle. Composite, or it is also known as the hybrid muscle. So I hope you are going on making the list of that right from upper limb onwards, guys. I have been telling you like so many composite muscle. So in that list you can add this one more muscle there. So a composite muscle is a muscle supplied by two nerves, and one of the example here is adductor magnus, guys. Perfectly done, and this entire concept is like crystal clear now. Now apart from that, any more MCQs which are possible here, sir, in the posterior compartment of thigh? Yes, of course. Out of all these hamstring muscles, remember semitendinosus, semimembranosus, and only the long head of bicep femoris. I repeat again, semitendinosus, semimembranosus, and long head of bicep femoris. These three are only the true hamstrings. These three are true hamstrings. Whereas the short head of bicep femoris and even hamstring part of adductor magnus, these are false hamstrings, or we can say modified hamstring. False or modified hamstring. Semitendinosus, semimembranosus, and long head of bicep femoris are actually true hamstrings, whereas the short head of bicep femoris as well as the adductor magnus hamstring part, these will be actually the modified hamstrings or false hamstring, guys. I think we have actually covered like almost every MCQ which is possible here. Now after completing the posterior compartment of thigh, I'm sure you still remember like the topic that we are studying here, guys. So we have completed posterior compartment of thigh, all the muscles present there, all the important MCQs possible. Now we are still studying which topic? Tibial nerve. And tibial nerve, let's continue down. It is also supplying to the muscles present in posterior compartment of leg. So let us now see like what are all the muscles present in posterior compartment of legs. So posterior compartment of leg. Now in the posterior compartment of leg, you'll be actually having the calf muscles. And one thing for sure, I have observed during even the live classes also, in the calf muscles, every medical student knows two muscles very well. One is gastrocnemius, and beneath that you'll be having soleus. Every medical student is comfortable with that one. So there will be two heads in the gastrocnemius. There will be lateral head, and then there will be a medial head. So lateral head and medial head, lateral head and medial head of gastrocnemius muscle. And beneath that gastrocnemius, what do you have, guys? You'll be actually having the soleus muscle. Soleus muscle. And along with that, you also have one small muscle here, that is plantaris muscle, guys. That is plantaris muscle. Perfect. Now let me show you all these things in a diagram over here. Now please look at this diagram here, guys. Now in this very first diagram, you are able to appreciate here, there will be a medial head of gastrocnemius, and then there will be a lateral head of gastrocnemius. Medial and the lateral head of gastrocnemius. And if you just cut this muscle, gastrocnemius muscle, and remove this, just beneath that you'll be able to appreciate the soleus muscle here. Or otherwise you can do one thing, you can even have one more diagram. That is the reason why we are even having like one more diagram for reference there. So you're able to appreciate here gastrocnemius, and beneath that there will be soleus muscle here. Perfectly done. And observe the lateral head of gastrocnemius more carefully. Along with the lateral head, you will be also having a muscle, that is plantaris muscle. So plantaris muscle along with the lateral head of gastrocnemius over there. Now these three muscles are actually present in the superficial layer. Now don't get confused about superficial layer and superficial compartment. I am not telling about the compartment. We are still in the posterior compartment only. In the posterior compartment, the muscles are actually arranged in the two layers, superficial layer and the deep layer. So we are now done with the superficial layer. So gastrocnemius and the soleus and plantaris, these three muscles are present in the superficial layer. Now sir, what about the deep layer? How to make it easy? Welcome here. I will help you in making that easier. Try to recall, in the topic of peroneal nerve, we have learned about the anterior compartment of the leg, okay? And in the anterior compartment of leg, we have one muscle in front of tibia, that is tibialis anterior, okay? Apart from that, in the anterior compartment, you have actually the extensor muscles, and that will be extensor hallucis longus. Another one will be extensor digitorum longus. Extensor hallucis longus, extensor digitorum longus. And now, right now we are in which compartment, sir? Right now we are actually in the posterior compartment. And I told you in the posterior compartment already about the superficial muscles. And now welcome to the deep layer. And deep layer, the muscles are so easy. You can just compare the names of these muscles with the anterior compartment. In the anterior compartment, we have tibialis anterior. So therefore in the posterior compartment, behind the tibia, tibialis posterior muscle. In the anterior compartment you have got extensors, and here in the posterior compartment you will be having flexor, flexor hallucis longus and then flexor digitorum longus. So these are the muscles present in the posterior compartment of leg. Let's include them. So these three muscles, gastrocnemius, soleus and the plantaris, these three muscles are the one which are present in the superficial layer. Posterior compartment only, but the superficial layer. Whereas we also have certain muscles in deeper layer, and the names are very much easier to remember, that is tibialis posterior muscle, tibialis posterior muscle, and along with that we also have flexor hallucis longus, another one will be the flexor digitorum longus. So there will be a flexor hallucis longus and flexor digitorum longus, guys. Now these three muscles are actually present in the deep layer. In the posterior compartment, these three muscles are present in the deeper layer. So posterior compartment of leg, we can again divide the muscles into two layers, superficial layer and deep layer. Perfectly done. Now after learning all the names of the muscles comfortably, now let us see the MCQs which are possible here. Welcome. Out of all these muscles, remember, number one, the two heads of gastrocnemius, that is lateral and medial head of gastrocnemius along with the soleus. In total 3 muscles. I repeat again, lateral and medial head of gastrocnemius, the two heads along with the soleus muscle, together they are referred to as triceps surae. Triceps surae muscles. So lateral and medial head of gastrocnemius along with the soleus, together it is triceps surae muscles. Number 1 MCQ. One more MCQ, which is a very old one and very famous one among the students. Out of all these muscles, one of the muscle is referred to as the peripheral heart of the body. So remember soleus. Soleus is actually referred to as peripheral heart. Peripheral heart of the body. Why? Because while walking, what is going to happen? That soleus, that calf muscle will actually contract and relax, and because of the contraction and relaxation of soleus, the blood will be actually pumped back into the circulation. Instead of getting accumulated in the vessels or the veins of the lower limb and in the long term leading to varicose veins and all. So instead of that, when you walk, the soleus muscle will contract and relax. Because of that, what is going to happen? The blood will be pumped back into the circulation, and that is the reason why it is actually referred to as the peripheral heart. So nowadays the kind of life that we are leading, very stationary life, no physical activities and all, that is the reason why that varicose vein is very much common, sitting at one place for a long time. That is the reason why it is always advisable to walk. So while walking, the soleus muscle will contract and relax, the blood will be pumped back into the circulation will be maintained, and that is the reason why soleus is referred to as the peripheral heart. One more MCQ which is possible here, plantaris. Plantaris muscle is the one which has got the longest tendon in the entire body. A muscle always attached to the tendon, and which muscle in our body, entire body, has got the longest tendon? That is the plantaris. Plantaris muscle has got the longest tendon. So these are all the important MCQs which are possible here. And after that, one more important thing which was recently asked in the AIIMS exam. In the leg region, we are actually having like 3 compartments: anterior compartment, posterior compartment and lateral compartment. Now where you don't have the neurovascular bundle, absent in which one or which compartment? It's actually in the posterior compartment of the leg. Leg, anterior, posterior and the lateral, 3 compartments, and neurovascular bundle is actually absent in the posterior compartment of the leg. Posterior compartment of the leg, that calf muscles. And in that also, to be like more specific, remember the neurovascular bundle is actually absent in the superficial layer. Superficial layer only. So neurovascular bundle is absent. That was a AIIMS exam question which was asked recently. So neurovascular bundle is absent in the superficial layer of posterior compartment of the leg. Perfectly done. And that finishes, that completes each and every concept, each and every MCQ related with the posterior compartment of the leg, guys. And I hope you still remember the topic we are learning. We are learning about the tibial nerve, and tibial nerve is the one which will be supplying to posterior compartment of thigh, done. The posterior compartment of leg, all the calf muscles, done. And now the tibial nerve is going to take a turn, enter into the foot. So when it is going to enter into the foot side, foot, on the medial side there will be a retinaculum, flexor retinaculum, and the moment it is going to cross, it will divide into the lateral plantar and the medial plantar, and those two plantar nerves are supplying to all the muscles of foot. All the muscles of foot will be supplied by medial and lateral plantar nerve. And now I'll do one thing here. I'll teach you about all the muscles of the foot, and they are actually arranged in the form of layers, like the first layer, second layer, third layer, and the fourth layer. Let us see all the muscles in the layers of the foot, which is very much important for your exams. So guys, continuing with the tibial nerve, supplying to the posterior compartment of thigh and the leg, and now welcome to the foot. Now this is the part where most of the students will be actually finding it more difficult to remember like which muscles will be present in which layer. That is one important challenge. And the second important challenge here is that not only about the muscles in each layer, the nerve supply. We have to also remember like which muscle is supplied by lateral plantar nerve and which muscle will be supplied by medial plantar nerve. I'll actually teach you a little bit with a concept here guys. Let's study like conceptually here. And again the same thing, it will be more better if you compare your hand with the foot here. It will be more better if you compare with the hand with the foot there guys. I'll tell you, just try to recall, it will hardly take a minute. In the hand we actually have like totally 20 muscles. And out of the 20 muscles, 4 will be thenar and 4 are hypothenar. You already remember this is like pollicis brevis and this will be digiti minimi. Digiti minimi. And then there will be like 4 lumbricals here. Then there will be 4 palmar interossei and 4 dorsal interossei. Now all these 20 muscles of the hand, they will be supplied by ulnar nerve and median nerve. And out of that ulnar and median, which one is more dominant nerve? Ulnar. Why? Because that is the one which is supplying to majority of the muscles. Out of 20, 15 will be supplied by ulnar nerve only. Try to recall very quickly in your mind. Ulnar nerve will be supplying to hypothenar, coming from the medial side, supplying to hypothenar. All your digiti minimi. And then ulnar nerve is the one which will be supplying to third and fourth lumbrical over here. Third and fourth lumbrical. And ulnar nerve will be the one supplying to all the interossei. The 4 palmar and 4 dorsal, all of them are supplied by ulnar nerve. And then it is going on the other side and also supplying to adductor muscle, adductor pollicis. If you just keep this in mind, that will help you a lot in learning the nerve supply to the muscles of foot. It will become like easy for you. Sir, how? Look here. So just keep your one finger over here. So imagine this one to be your ulnar nerve over here. And just keep another finger over here. Imagine this one to be the median nerve, ulnar and median. Now just do one thing, ulnar nerve and the median nerve, just do one thing. Make your hand like a foot now. You just make your hand like a foot now here. So therefore, the ulnar is the one which is corresponding to the lateral plantar nerve and median nerve is the one which will be actually corresponding to the medial plantar. So ulnar is actually corresponding to the lateral plantar, whereas the median nerve is the one which will be corresponding to the medial plantar nerve. And we all know very well, ulnar is the dominant nerve in the hand here. Lateral plantar nerve will be the dominant nerve in the foot there. This is the thing which will make the entire nerve supply to all the muscles of the foot damn easy. After this, I don't even have to teach you. Yourself can apply the logic and compare and remember that. Okay. So whatever muscles are supplied by ulnar nerve like digiti minimi, third and fourth lumbrical, all interossei, adductor pollicis, exactly the similar ones will be supplied by the lateral plantar nerve, the corresponding nerve. Okay. So keeping this entire concept in our mind, let's get started right now with the first layer of the sole. So on the screen there, you are able to see the first layer of the sole. Achha, one more important thing here, how are these layers arranged? For example, if this is the foot here, the lowermost one will be the first layer. I remove the first layer, then I'll be able to see the second layer. Remove that, then third layer. So if you are looking at your sole from below, that will be the first layer, then the second, then the third and fourth. So we are going like more deeper. From superficial, we are going like more deeper. So this is the first layer. Now in the first layer of the sole here, you'll be totally having like 3 muscles. There are 3 muscles present in the first layer of the sole. 3 muscles. Now what will be the name of these 3 muscles? Number 1, you are able to see one of the muscle going to the great toe here, and that will be actually your abductors. Okay, so it is your abductor hallucis here. Abductor hallucis here. Obviously, in the hand will be using the word as pollicis, whereas here it will be hallucis. And similarly, what is this one here? This one here will be for little finger or little toe there. So therefore, the name of this one will be again digiti minimi, abductor digiti minimi, abductor digiti minimi. So the outermost one will be actually your abductor there, abductor hallucis and abductor digiti minimi. Then apart from that, there is one more muscle present in the middle here, and this is the one which will be supplying. You can clearly see dividing into 4 tendons and supplying to the digits. So therefore, the name of this one will be flexor digitorum. flexor digitorum brevis. Obviously it can't be longus. Why? Because flexor digitorum longus, already we have seen the long muscle coming from the leg region, the posterior compartment of leg. So this is definitely the brevis one, the shorter one, flexor digitorum brevis muscle. Now once you are done with the naming of the muscle, like in the first layer we are having three muscle, abductor hallucis, abductor digiti minimi and flexor digitorum brevis. Once you are done with the naming of this muscle, now what will be the nerve supply? Come on, for nerve supply you have to always compare with the hand, the muscles of hand, and here I told you already, digiti minimi, all your digiti minimi will be supplied by which nerve? All the digiti minimi will be supplied by ulnar nerve, and corresponding to ulnar nerve, what do you have in the foot? That will be lateral plantar nerve. So therefore, abductor digiti minimi should be supplied by lateral plantar nerve. Done. Whereas on the other side, abductor, pollicis and all this flexor digitorum here and all will be actually taken care by the medial plantar. So it is supplied by the medial plantar nerve here, and even this one is also supplied by the medial plantar nerve. Perfectly done. That completes your first layer of the sole. Now if I remove these three muscles over here from the first layer, then I'll be able to appreciate the second layer over here, guys. Now look at this beautiful diagram. This is the second layer of sole. And one more symmetry here is that in the second layer of the sole, you'll be able to find two tendons, and then there will be two muscles. So it's like symmetrical. Second layer, there will be two tendons and two muscles. Now what will be the two tendons present here? Let me show you here in this diagram here. One of the tendon coming from here, and that tendon will be actually going to the great toe. Okay. So one of the tendon actually going to the great toe there. Now try to understand here, if this is your sole here, and if the tendon is coming from here and going to the great toe, that tendon is actually coming from which compartment? Is it from the anterior compartment of the leg or posterior? Makes sense, it is coming from the posterior compartment. And if it is coming from the posterior compartment of the leg, definitely it will be which one, guys? Flexor only. So therefore, what should be the name of this tendon here? This one will be flexor hallucis longus. Flexor hallucis longus. There will be a long tendon coming from the leg region going to the great toe, flexor hallucis longus. And one more tendon coming again from the leg region only, but it is going obliquely and it is dividing into four tendons going into the digits. And because of this reason, guys, it makes sense. Okay, what should be the name of this one here? What should be the name of this tendon here, which is like going obliquely? That's flexor digitorum longus. So one will be the flexor hallucis longus tendon, another one will be the flexor digitorum longus tendon. So we are comfortably done with the two tendons present over here. But remember that muscle doesn't belong to the muscles of foot. That muscle is already present in the leg region. We only have the tendons present over here. Done. Now what about the two muscles present here? So I'll tell you this little bit conceptually. Try to understand this concept here. Again the same thing. For example, if this is the foot, flexor digitorum longus tendon coming from here, going obliquely like this. Four tendons are going into the four toes there. Now, if this tendon contracts, I mean to say if this muscle contracts, the tendon is pulled. If this tendon is pulled, will all your toes contract or flex in this manner? Absolutely no. Why? Because the tendon is coming obliquely here. That is the reason why if the tendon is pulled here, this toes will actually turn in this manner. Just look at the direction of the pull there. So, if this tendon is pulled here, if FDL, flexor digitorum longus tendon is pulled, that means all my digits, all my toes has to go in this manner because it is pulling here like this. It's absolutely wrong then. Then I will not be able to walk properly whenever it is going to flex. So therefore, to correct the direction of that pull, we are actually having a muscle over here. And this muscle, rectangle shaped muscle, look at the way, if it contracts in this manner, that means it will not allow all your toes to bend like this, guys. They'll be actually flexing in the same manner. So that's the reason why this muscle is present over there. And we can clearly see the shape. It is actually rectangle or quadrangular in shape, and it is present in the plantar region. And that is the reason why it is known as quadratus plantae muscle. So therefore, this muscle here will be the quadratus plantae muscle. Now this quadratus plantae muscle, it is also helping in flexion of digits only, right? That is the reason why it is known as flexor digitorum, but it is neither longus nor brevis. Remember, this is accessorious. Flexor digitorum accessorious muscle. And here also the name makes sense. It's actually assisting the flexion of the toes in the right direction. It is an accessory muscle, flexor digitorum accessorius, assisting the flexion of the toes in the right direction instead of going obliquely like this. Done perfectly here. Then again the next one, guys, after completing this muscle very conceptually here, the next thing is easier. Why? Because next thing that you are able to appreciate in this diagram, the next muscle that you are able to appreciate here is lumbricals. And how many lumbricals do you have in the hand? There are 4 lumbricals, and even in the foot also you actually have like 4 lumbricals here. Now in this diagram you are able to appreciate here lumbrical number 1, lumbrical number 2, then 3, then 4. So L1, L2, L3 and L4, I am just writing here for the sake of a representation, like 4 lumbricals. But be very careful here, the first lumbrical is the only one which is unipinnate here. Whereas the second, third and the fourth, you can see very clearly in the diagram, those all will be your bipinnate ones. So the second, third and the fourth lumbrical, all of them will be actually bipinnate. The moment you appreciate this important detail here about the lumbrical, nerve supply will become damn easy. Try to recall. In the hand, there are like 4 lumbrical. Out of the 4 lumbrical, first and second one, the first and second, these 2 lumbricals will be unipinnate. And those 2 unipinnate lumbricals, they are the one which are supplied by median nerve. And which is the nerve corresponding to median nerve in the foot? Medial plantar nerve. That's the reason why unipinnate one, this one should be actually supplied by your medial plantar one. So remember an important difference here. In the hand, first and second lumbrical is supplied by median nerve, whereas in the foot, only the first lumbrical is supplied by medial plantar nerve. Hope I am not confusing you here. Now again, in the hand, the third and fourth lumbrical bipinnate, and bipinnate ones are the one which will be supplied by ulnar nerve. And what is the nerve which is corresponding to ulnar nerve in the foot? That is lateral plantar. So therefore, all the 3 of them, L2, L3 and L4, the second, third and the fourth lumbrical are supplied by your lateral plantar nerve. Now what is the only muscle that is left out after lumbricals here? That is quadratus plantae. Even that is also taken care by lateral plantar nerve only. Perfectly done. So in the second layer, we are actually having like 2 tendons and 2 muscles over here. 2 tendons and 2 muscles, and I told you that 2 tendons are coming from the leg region only, and the 2 muscles which are present over here are actually taken care by your lateral plantar and medial plantar nerve, and I told you the entire detail about that one. Now after completing the second layer of the sole here, let us now move on to the third layer of the sole. And I told you all these layers are from superficial to the deep. So this is the foot here, this is the sole here, first layer present below, removed, second layer removed, and now we'll come to the third layer. And in the third layer, again the same thing, guys, you are actually having again 3 muscles here. Same like your first layer also have got 3 muscles, and here also we are having 3 muscles here. Now what will be the name of these 3 muscles in the third layer? There will be flexors. So this one here will be the flexor, that is flexor hallucis brevis obviously, and this one is also the flexor, and this one will be to the little finger or little toe. So therefore it will be flexor digiti minimi. Flexor digiti minimi. So one will be the flexor hallucis brevis, another one will be flexor digiti minimi. Done. Then what about the muscle? One more muscle that you are able to see here. You can clearly see one will be the oblique head, another one is the transverse head, and when these 2 muscles are going to contract, they are going to adduct. When these 2 muscles will actually, those 2 heads will actually contract, they are going to adduct. And if it is going to adduct the great toe, definitely the name of this muscle has to be adductor hallucis. So let me just put a star mark here, and the name of this muscle is adductor hallucis. Adductor hallucis. Now, once we are comfortable with the names of these 3 muscles over here, flexor on either side, then in the middle we are actually having adductor hallucis. Easily you can identify that layer, that is the third layer. Now, once you are comfortable with the names of this muscle, the next thing is the nerve supply. What is the nerve supply into all these 3 muscles? Come on, again recall the thenar group of muscle. You will be actually having flexor pollicis brevis, and here it is flexor hallucis brevis. Flexor pollicis brevis is supplied by median nerve. Corresponding to that, you will be actually having medial plantar. So medial plantar nerve supplying to that. What about the digiti minimi? Digiti minimi here will be supplied by ulnar nerve, and corresponding to that will be actually having the lateral plantar nerve. lateral plantar nerve. Fine. And then I hope you remember that important exception in the hand. The adductor pollicis muscle is not supplied by median nerve, it is actually supplied by ulnar nerve coming from the other side, the deep branch of that, of course, adductor pollicis. So similarly here, adductor hallucis will be supplied by lateral plantar nerve. So ulnar nerve is corresponding to the lateral plantar nerve over here. It makes the nerve supply easy. I request all of you with folded hands, try to follow my trick here, guys. So name of the muscles and as well as the nerve supply, we are making it easy. Then welcome to the last and final, the fourth layer of the sole here, and I love this layer, guys. Why? Because in this layer we just have the interossei. In between the metatarsals you are able to find the interossei, and again the same thing in the fourth layer you will be actually having interossei, and I was telling you again the same thing here, you will be actually having the plantar interossei and the dorsal interossei. Like in the hand we have got 4 palmar interossei and 4 dorsal interossei. Similarly, in the foot, you will be having plantar as well as the dorsal interossei. But one difference here, how to identify. How to identify, the moment you look here, you can see the unipinnate and the bipinnate, and the unipinnate one will be the plantar. So, in the very first diagram here, this will be the plantar interossei, and in the second diagram here, this will be your dorsal interossei. Yes, the one difference which I was actually speaking about, the one difference here is that the palmar interossei, there are totally like 4 of them, but you can clearly see in my diagram here, yes, the plantar interossei, there will be only 3 in number. There will be only 3 plantar interossei, whereas there will be like 4 dorsal interossei. 3 plantar and 4 dorsal interossei. Number differs here, and the remaining everything is same only. Even the plantar interossei will be unipinnate, but the dorsal interossei will be actually bipinnate. Perfect. And now welcome to the nerve supply, and we have studied so much over here that now you already got the trick how to handle the nerve supply to all these muscles here. So in the hand, all interossei are supplied by ulnar nerve, and ulnar nerve corresponding to that in the lower limb, I mean to say in the foot, the ulnar nerve will be corresponding to which nerve there, guys? The lateral plantar. That is the reason why all your interossei, whether it is plantar interossei or dorsal interossei, they should be supplied by which nerve only? The lateral plantar nerve. All the interossei are supplied by lateral plantar nerve, no doubt about that. So the fourth layer is very much simple. So what I do always, how do I remember here out of these 4 layers, if you have observed very carefully, guys, first layer will actually have 3 muscles in that. The first layer will have 3 muscles in that. The second layer, it's like a rule of 2, everything is symmetrical there, 2 tendons and 2 muscles there. Whereas again the third layer again will have how many muscles, sir? 3 muscles. So first layer 3 muscles, second layer it's like 2 and 2, 2 muscles, 2 tendons. Third layer again 3 muscles, and welcome finally to the fourth layer. No need to even study that one, it will just have interossei. It will have interossei. Okay. Next, after completing this muscle, so I repeat once more here, first layer 3 muscles, second layer it's 2 muscles and 2 tendons, third layer again 3 muscles, and the fourth layer will have interossei. And after that, the nerve supply. I told you very conceptually how to remember the nerve supply, like always compare your hand with the foot, so simultaneously you are able to learn both the topics easily. So ulnar nerve is corresponding to lateral plantar and median nerve is corresponding to the medial plantar. That is like one way of learning conceptually. Now another way of learning that I'll tell you, like one more method, you are mature enough to follow any method. So as my responsibility, I'll tell you like all the methods possible and you follow whatever you like. Another method of learning here is that if you observe the number of muscles which are supplied by medial plantar, medial plantar nerve will be supplying to abductor hallucis. It is also supplying to flexor digitorum brevis. Abductor hallucis and flexor digitorum brevis. 2 muscles over here. And then it will be supplying to the lumbrical number 1, medial plantar nerve. Third muscle over here. And then it is also supplying to flexor hallucis brevis, the fourth muscle. Out of all the muscles present in all the 4 layers, remember, medial plantar nerve is supplying only to 4 muscles. Medial plantar nerve is supplying only to 4 muscles. That's all. Remaining all will be taken care by lateral plantar. So you can even learn in this manner also. So if you don't want to go in a conceptual manner, comparing every time the hand muscles with the muscles of the foot and comparing every time each and every layer, if you don't want to learn in that manner, better you can even follow this manner also. So 4 muscles are supplied by medial plantar nerve, whereas everything else will be taken care by lateral plantar nerve. Now it's depending on you to follow whatever method you like. And my dear friends, don't forget which topic we are still learning. We are still learning about the tibial nerve. So tibial nerve, that is the reason why I said in the very beginning, okay, it is the biggest one. Like so many, muscles here, so many compartments done here. Come on, let's recall for the last and final time. Tibial nerve will be supplied to posterior compartment of thigh, all the hamstring muscles done. Posterior compartment of leg, the calf muscles done. And now the tibial nerve will take a turn and divide into the medial and the lateral plantar nerve, taking care of muscles of foot. But still, something else is remaining. We have actually completed only the motor supply. We have motor supply. So tibial nerve will be supplying to the muscles. We have done with that one. Now let's learn about the cutaneous supply, sensory supply. In sensory supply, remember tibial nerve is the one which will be taking a turn here near that medial. I told you, medial, on the medial side there will be flexor retinaculum. It will be taking a turn there and then dividing into the two branches there. One is lateral plantar and medial plantar. And look at the beauty here, guys. Right from beginning of lower limb topic, I am telling you, upper limb and lower limb we have got the same planning. God has made our body easily. Why? Because I can prove you once more here. Lateral plantar is the one which is taking care of lateral 1.5 digit here, the skin covering that. And medial plantar nerve is the one which is taking care of the medial 3.5 digits over here. I hope you remember that same numbers, even in the hand also. Medial 1.5 digit here, the lateral 3.5 digit. So exactly the same, guys. And of course, it is in the plantar region. So let us now start with the sensory supply of tibial nerve. Sensory supply of tibial nerve. And in sensory supply of the tibial nerve, let us first of all see the plantar surface. So in the upper limb, we have seen the palmar surface, and now let's see the plantar surface here. Now in the plantar surface, for example, if this is the great toe here, and these will be the remaining toes over here, guys. Imagine this is the plantar surface. Now after that, just draw one imaginary line here, like lateral 1.5 digit. Now skin near the heel region will be supplied by tibial nerve. And then remember the lateral 1.5 digit. Lateral 1.5, the skin covering this one will be taken care by lateral plantar nerve. And not only that, the medial 3.5 digit. Medial 3.5 digit, that will be actually taken care by medial plantar nerve. I hope this makes it easier. Apart from the plantar surface, remember tibial nerve is also giving one more cutaneous branch, and that cutaneous branch is sural nerve. It is also giving one cutaneous branch here, sural nerve. Now sural nerve will be supplying to what? First of all, let us write down here, then I will show you that picture in the atlas image also, guys. Sural nerve. Now sural nerve, it will be actually supplying to the skin on lateral side of the leg and the foot. It will be supplying to skin of lateral side of leg and foot. Now what is the meaning of this one here? To understand the meaning of this one here, sir, just look at this diagram here now. Now in this diagram here, imagine this one, this part here to be your leg region here, and this will be the foot here, and the skin on the lateral side of the leg and the lateral side of the foot will be supplied by sural nerve, which is in turn a branch of your tibial nerve. So sural nerve will be supplying to the skin on the lateral side of the leg and the lateral side of the foot, and it is actually a branch of tibial nerve. And a communicating branch will also come from the another nerve, guys, that is your common peroneal nerve also. Fine. So that completes the entire motor supply to all the muscles as well as the sensory supply of tibial nerve. So we have completed that in detail, and the most important thing is about the muscles of foot arranged in that 4 layers. Extremely important for all your PG entrance exams, guys. So please take care about that. Thank you.